Health coach training and education has really been evolving over almost 2 decades. The earliest, well, we've had coaching training in general for probably between 30 and 40 years. Health and wellness coaching really got started almost 20 years ago, and really started with entrepreneurs with small private foundations and organizations doing educational programs, sometimes private one-on-ones, but also within corporations and for large employers. And that field in the last 10 to 12 years has really taken off with more players entering into the field. Probably the largest volume trainer of health coaches we currently have as well coaches, and they've been at the job for 11 or 12 years now. And I think one of the biggest steps that we've seen is with credibility and with recognition in the market. Academic institutions have started to step up to the front. I'm at the University of Minnesota, and we began our program 10 years ago. And so there's really this evolving spectrum of everything from smaller, more limited, directed, focused programs done for groups in corporate settings, insurance settings, for different kinds of employers, all the way to degree programs at major universities. So there's a very wide spectrum, and that's really one of the gifts in the field, but also one of the challenges about how do we come to common terrain and really agree upon what does it really mean when somebody says that they're a health and wellness coach. There is a huge and I think growing swell of interest from people from many, many different areas of background and professional practice that are coming to health and wellness coaching as a new career, as a new profession. There's a natural flow of those from different healthcare professional backgrounds, nurses, psychologists, social workers, allied health, nutritionists, even physicians. And for those people, adding on to the existing training that they have in whatever their area of expertise is, with kind of an augmenting that skill set with coaching training is a natural fit for people that are going to be working in the health and wellness area. The really fascinating thing to me has been watching the people from widely varying fields who are coming to this saying, this is what I've dreamt of doing my whole life. I have architects, engineers, lawyers, who have had a personal calling in the area of health and wellness for years but have never worked in the field professionally, that are now seeing an opportunity to take the passion that they have and to kind of retrain to be able to work with people in a way that's very health focused, it's prevention focused, it doesn't have the disease framework that is the reason why many people didn't go into the healthcare field to begin with. And so we're really seeing people wanting to now cross-train from many different professions. So that's raising interesting challenges for those of us who are in education realms. You know, how much do they need to know about medicine? How much do they need to know about healthcare? And how much do they just really need to be a good coach? And that's really an area of the field that we're trying to get clarity on. I think there's pretty strong agreement from across the consortium and the training schools that are there that people need a solid background with at least a bachelor's degree or if not a bachelor's, a licensed healthcare profession of some kind. But that bachelor's could be in different areas, and they can add education on top of that. And the irony is sometimes I find some of the absolute best health and wellness coaches haven't come out of the ranks of conventional healthcare because they bring fresh eyes and they're not jaded by the pathology perspective that is so prevalent in all of the areas of, I come from medicine and I certainly took a long time to recover. And so while healthcare, medicine in general and healthcare more broadly has done some wonderful things, looking through the lens of health and wellness has not been the orientation of that field. So I think now there's an opportunity for people to come and to bring their passions in different ways, and they'll need different training and different skill sets, and we're creating those new routes for people. But I think it's going to create really a fascinating new face of what healthcare could look like. Well, in academic settings, there really are 3 different ways that people can come and obtain educational training in the field of health and wellness coaching. One is to really come in just through professional continuing education. you know, a kind of a contact hour, continuing education, and that's a common path that some students take, and that's really designed predominantly for people who are practicing healthcare professionals of some kind. The second is the route that we started with at University of Minnesota, which several other schools have done as well, which is really to do what we call a graduate certificate. It's not a full degree program. It's a good fit for people that have existing, particularly graduate education already. If you already have a master's or a PhD or a specific degree in a field that's in healthcare, to add a health and wellness coaching certificate onto that gives you the content that you need, and you already have a degree that's at the height that you need in order to get into the job market. I think the third path that is really just newly opening up, and it's something that we just stepped into this year at University of Minnesota, is to offer actually a full master's in integrative health coaching. And the reason for that is twofold. One is we have new and excited youngsters, really, who are coming right out of undergraduate training with bachelor's degrees and knowing that this is the professional field that they want to work in. And they know and recognize in this competitive job market that they really need a master's degree to get into many different kinds of positions in healthcare, and that may be in future leadership and other things, but they want a graduate degree. The second is really for those people who, you know, I've alluded to previously, that have done other kinds of study, and so they're really leaping fields, and they need to gain some greater understanding in the areas of lifestyle medicine, mind-body skills and mind-body science, understanding chronic conditions, foundational nutrition and movement practices. And so for those people, it's a really natural fit to come back to the graduate school and actually get a full master's degree in the area of health coaching, so that they can have adequate skill sets to be able to go out into the job market, work in healthcare settings, and be able to understand the system that they're entering into. So one of the primary reasons that we founded the National Consortium for Credentialing Health and Wellness Coaches is to define necessary standards around kind of the minimal criteria for what's needed for education and what's needed for training. When a new profession is evolving, when it's first getting started, it's widely variant. It's a little like the Wild West, and you have people with mom and pop shops that are doing 1 or 2 day trainings. You have people that have done very little training or have purchased a certificate without really any education, and then you have people that have studied for decades. So it's really important to bring together all of the stakeholders in the field and to combine our voices and to stand up and be heard and say, we believe as professionals in the field that this is kind of where the minimal bar is set. This is the minimum that people need to have in their knowledge base, in their applied skills, and their ability to interface in the existing healthcare system. And by having an organization like the National Consortium, we have the ability to bring all those voices together and to be able to let employers, third-party payers, government officials hear our voices and recognize that there's a credible source for standards. And once those standards are there, then educational programs need to step up to meet those standards. And that's a really natural progression. And so I think by putting out the items that we've agreed upon in a way that it's recognized nationally, then as new schools come on the scene, as new training programs are developed, they'll know where they need to go in order to kind of meet the expectation for a recognized and eventually accredited training program.